how to recognize the signs and symptoms of tuberculosis. Step 1. Notice any unusual coughing. TB usually infects the lungs, breaking down the tissue there. Our body's natural response is to remove the irritant by coughing. Figure out how long you've been coughing. TB usually lasts for more than 3 weeks and may include such worrisome signs as bloody sputum. Step 2. Look for discharge when coughing. Have you noticed any sputum, sticky discharge, when coughing? If it smells and is dark, it can be any type of bacterial infection. If it's clear and odorless, it can be a viral infection. Take notice if there's been any blood when coughing into your hands or tissues. When TB cavities and nodules form, nearby blood vessels may get destroyed, leading to hemoptysis, coughing up blood. Step 3. Pay attention to chest pain. Chest pain can suggest a wide variety of issues, but when taken together with other symptoms, they can point to TB. If you feel a sharp pain, it can point to a specific, localized area. Note particularly if it hurts when you apply pressure to that area, or if it hurts when you breathe in and out or when you cough. Step 4. Take note of unintentional weight loss and lack of appetite. The body has a complex response to the Mycobacterium tuberculosis bacteria that results in poor nutrient absorption and altered protein metabolism. These changes might persist for months without you noticing them. Step 5. Do not ignore fever, chills and night sweats. Bacteria usually reproduce at around normal body temperature, 98.6 F. The brain and immune system respond by raising the body's temperature to stop the bug from reproducing. The rest of the body detects this change, then attempts to adjust to this new temperature by contracting muscles, shivers, making you feel chills. TB also causes specific inflammatory proteins that aid in fever production to be produced. Step 6. Beware of latent TB infection. A latent TB infection is dormant and not infectious. The bacteria simply resides in body with no harm. Reactivation can occur in those with reduced immunity, as listed above. It can also occur with increased stage due to weakening of the immune system. Reactivation sometimes also occurs for other, unknown reasons. Step 7. Be able to distinguish TB from other respiratory infections. There are many other conditions that TB could be mistaken for. You don't want to wait out the simple cold virus only to find out that you have something more serious on your hands. For more,
chest X-ray PA view on a 15-year-old male with history of cough. The X-ray clearly shows 2 well-defined thin-walled air-filled cavities in right upper lung. There is at least 1 cavity in left upper lung as well. There is no loss of lung volume. You can see fibrosis and pleural changes in both upper lung fields. There is no loss of lung volume despite of scarring in upper lobes. Lower lung fields are comparatively normal. Heart size and shape within normal limits. Both right and left claustrophrenic angles are clearly visible, means there is no pleural effusion. There is no sign of hilar or paratracheal lymphadenopathy. Axial CT scans here and here show multiple cavities with infiltrates. The patient was diagnosed to have active tuberculosis. Such cavities are common in tuberculosis but can also be seen in some other pathologies. Common features of tuberculosis in lungs are cavities, fibrosis, hilar lymphadenopathy, and loss of lung volume. But hilar lymphadenopathy or loss of lung volume may or may not be present. In early stage of infection, you'll see scarred tissue in upper lobes only, without any other finding. The X-ray is courtesy of Dr. Daniel Hankins, University of South Alabama, USA. Thank you very much.